Hey everyone, I'm Dr. Tyler J. Tolbert from Smile Now Dental Group. We recently got a message from a patient that went like this. I'm 2 weeks post-op and still getting little sore bumpy spots in the crease of my lower gum line, and the roof of my mouth still feels a bit angry. Should I be worried? Am I not healing right? If you've had implants placed, especially full arch upper and lower, you might be wondering the same thing. So in this video, I'll walk you through what's normal to feel 2 weeks after surgery, what signs to keep an eye on, and when it's time to give your dentist a call just to check in. First, let's normalize the healing process. If you're still feeling some soreness, bumps, or general irritation 2 weeks after your procedure, that doesn't automatically mean that something is wrong. Here's why. The crease between your lip and your lower gum line is a high friction area. As you begin talking, eating, and moving your face more after surgery, it's not uncommon to get some sore spots, irritation, or small pressure points, especially if you're wearing a temporary prosthetic. The roof of your mouth, the palate, is also sensitive. Even if we didn't operate directly on that tissue, it can feel irritated from swelling, dryness, or rubbing from the temporary arch. The bottom line is 2 weeks is still very early in the healing timeline. So mild discomfort, tenderness, or even a bumpy feeling is common as the tissue adjusts. Here's a list of symptoms that we consider normal at the 2-week mark. Mild soreness in specific spots, occasional bumps or raised areas that come and go, sensitivity when eating or brushing, feeling like your gums are still adjusting to the prosthetic, and the roof of the mouth feeling dry, irritated, or tender. These are all part of the soft tissue response to the healing and wearing a new appliance. That tissue has gone through a lot. There's been extractions and implant placement, swelling, and now you're adapting to something new. Your body is still finding its new normal, and that takes time. That said, there are a few things we want to know about sooner rather than later. Give us a call if you experience persistent swelling that's getting worse, not better, pus, foul odor, or bad taste near the implant sites, sharp or unmanageable pain that doesn't improve with over-the-counter meds, a prosthetic that feels loose, unstable, or painful to wear, sores or ulcers that aren't improving or are bleeding. None of those are necessarily emergencies, but they are worth checking so we can keep healing on track. At Smile Now, we take post-op care seriously. We don't just place implants, we guide you through recovery with detailed post-op instructions, ongoing check-ins from our team, access to natural healing products like Stella Life to reduce irritation, and fast in-house adjustments if your prosthetic is rubbing or causing pressure points. We want you to feel supported, not unsure or left guessing. If you're watching this and you're 2 weeks post-op feeling sore or a little unsure, you're not alone, and you're probably right on track. Your gums are adapting, your soft tissues are reshaping, and that initial tenderness usually fades by week 3 or 4 as things start to settle. So just keep eating your soft foods, follow your rinse protocol, and avoid anything spicy or abrasive, and give yourself some grace. This is your body healing, and it takes time, not perfection. Your brain still has to figure out all these new teeth in your mouth, and that's going to take some time. So if something doesn't feel right, or even if you're just looking for some peace of mind, give us a call. Click the link in the description to schedule a quick check-in or follow-up at Smile Now Dental Group. We'll take a look, make adjustments if needed, and make sure your healing stays on the right track. Thanks for watching, and as always, don't forget to like and subscribe for more honest answers about healing, implants, and long-term smile care. We'll see you in the next video.